The healthcare crisis in the United States has reached an unprecedented level, with 29 million Americans now unable to afford or access basic medical care. This marks the worst situation since researchers began tracking these trends in 2021, and the problem is only worsening. The consequences are dire. Millions of people are forced to borrow money, sacrifice other necessities, or go without critical medical attention. The stark reality is that the American healthcare system is failing its most vulnerable populations, and the divide between those who can afford care and those who cannot is growing at an alarming rate. The new research from West Health and Gallup exposes a deeply troubling picture. The number of Americans classified as cost-desperate, those who can neither access quality healthcare nor afford necessary treatment, has risen to 11%, a 3% increase since 2021. But the national average hides a more disturbing truth. Certain demographics are suffering at much higher rates. Hispanic adults have been hit the hardest, with 18% now categorized as cost-desperate, an 8% jump in just 4 years. Black Americans follow closely behind at 14%, while white adults remain at 8%, showing little change. These disparities highlight the racial and economic inequality embedded in the U.S. healthcare system. The situation for low-income households is even more devastating. Among those earning under $24,000 per year, a staggering 25% are now cost-desperate. That means 1 in 4 of America's poorest citizens is unable to afford even the most basic healthcare needs. The causes of this crisis are numerous: rising medical costs, persistent drug shortages, increasing Medicaid disenrollment, and major cuts to public health insurance programs like the Children's Health Insurance Program, CHIP. These issues have been worsening for years, and now they are reaching a breaking point. The study also examined Americans who are cost-secure, meaning they have stable access to affordable healthcare. The results are grim. Only 51% of Americans now fall into this category, the lowest percentage ever recorded. For Hispanic adults, the situation is especially dire. Just 34% are considered cost-secure, a staggering 17% decline since 2021. Similarly, only 41% of Black adults now have reliable healthcare access, down 13% in the same period. Meanwhile, white Americans have largely maintained their healthcare security, with 58% still able to access and afford care. The financial divide is growing sharper as well. Among those earning less than $24,000 per year, only 23% qualify as cost-secure, a drop of 14% in just 4 years. For middle-income households earning between $24,000 and $48,000, the numbers are almost as bad. Only 30% have stable access to healthcare, down 12% since 2021. By contrast, higher-income households, particularly those earning over $120,000 per year, have seen little to no decline in healthcare access. The result is an increasingly two-tiered system: comprehensive care for the wealthy and an unstable, failing system for everyone else. Behind these statistics lies real human suffering. The research shows that 12% of American adults were forced to borrow money to pay for medical care last year, contributing to a staggering $74 billion in medical debt nationwide. Many Americans now live in constant fear of financial ruin due to unexpected medical expenses. Nearly 60% of people worry about going into debt over a major health event, and many have had to cut back on food, rent, and utilities just to afford treatment. Others remain trapped in jobs they dislike simply because they can't afford to lose their health insurance. The American healthcare system is increasingly fractured. For those with the financial means, medical care remains relatively stable. But for millions of others, it is a constant battle, one they are losing. With inflation driving up costs and government programs providing less support than ever, the future looks bleak. Without serious intervention, this crisis will only deepen, leaving an ever-growing number of Americans unable to access the care they need. The warning signs are clear: the U.S. healthcare system is failing. If current trends continue, the number of people unable to afford care will only increase, exacerbating health inequalities and pushing millions further into financial distress. The question now is not whether the system is broken, it is how much longer it can hold together before collapsing entirely.